You are listening to the MDClone Talk Data Podcast, the show that uncovers healthcare insights, technology innovation, and discovers new ways to understand data possibilities. We bring together industry leaders, customers, and innovators to drive the future of care delivery. Let's talk data.
So thanks for joining us today at HIMSS to talk through a bit of your journey with MDClone, some of your experiences, and what data-driven organizations, health systems, operations can look like to really transform the way we deliver care, the way we learn, the way we partner with within our organizations and outside. So maybe we start a little bit with your role, and then we can talk about your journey with MDClone, and we'll take it from there.
Well, thank you for having me, Daniel. Michelle. My name's Julie. I'm with the University of Chicago Health System, but on the university side. And my role is the executive director for the Center for Research Informatics. And I co-direct our Adams Center with Dr. Tom Spiegel.
Michelle?
I am Michelle Schneider. I'm a registered nurse with MDClone, and I'm a clinical specialist. I support implementations. I support sales process by providing demos, and I also provide feedback that we get from customers to our product team so that we can just create a great pattern.
So we have a common thread of nursing here, which I think we'll touch on in a moment. But let's maybe touch on your vision a bit for a data-driven organization.
Sure. Yeah. Thanks. I guess in my intro, I did not mention that I'm also a critical care nurse by background. And so part of what I do is translate data requests or faculty needs into actionable items through data. And so one of the goals we have with MDClone is to do that faster, more expediently, and without the sort of added layers of analysis. And so the goal that we have is to just put data in the fingertips of our clinicians, our faculty members, our administrators, with the help of your platform, so that we can, move quickly to a decision or fail fast and pivot to a different.
So Michelle, you've seen this across many different customers, many partners around the world even. What have you seen? What are some common threads for their vision that you've seen really come to life?
I think the interesting thing for me is even before coming to MDClone, I was a critical care nurse as well. And I actually saw customers go from paper. I had to help them go to an electronic medical record. And they've been working for so many years to get that data into the system. They're like, why are we doing this? Nobody's even using it. And now, fast forward 10, 15, 20 years later, and finally we can do something with it. And I think I felt like coming to MDClone, that is finally where I got to see us put the data into the hands of those nurses who were like, why have I been doing this? The physicians who've been, forced to go to CPOE is what it was called back in the day, and doing all of that. And now we put that in their hands and they can use it to understand what they're doing, how they're doing. It's their report card. How can we be better? How can we improve patient care? And that's what people want to do. That's why they come to MDClone, because the physicians, the nurses, the researchers need that access, and we can provide that. So I am just passionate about it. I'm happy to be able to help make that happen.
Let's stay with you maybe and dive in. Let's give an example. What's a project, something you worked on recently, you've seen someone at one of our partner organizations work on recently that's excited you or excited them?
We have a lot of really cool projects. I think some of the ones that I get excited about are women's health, because it is not studied very well. And there are people who want to study it, and it's not always the thing that gets the top of the list, So we've been working with a group at Washington University around menopause and the care of patients of diverse groups and how well they're cared for, how speedily, and what types of interventions are used. And so that felt really rewarding, like we're going to be able to provide insights that aren't easy to find. When you do a lit review, there's just not a lot out there. And so that excites me, being able to do that. So that was just one recently that I think was just affected me, and I was proud to be a part of it.
How about you, Julie?
We're still working through our data sort of internally, but I think we had a really pivotal moment at AMIA this year when I partnered with NHN and as we're preparing for our presentation, I'm talking about the why of, why did we choose this platform, which we've been talking about. And Annie delivered following me the sort of like the how, like what did we do? And as we were preparing, we're looking at also a women's health project, but which is always, again, they're timely, right? But it was about abnormal menstrual bleeding, right? And how it disproportionately affects some women over others. And it's something that could be relatively easily solved with some change in practice. But what really excited me is being able to do that. So as I'm working with the team and preparing our slides and getting everything ready, I said, hey, do we have enough data in our platform yet to see if we can pivot and do the same project? And within an hour, we built about 80 to 85% of that same data set right there. And I was like, this is exciting. I can take this back to an actual doctor and deliver them a playbook or sort of a bill and say, hey, you want to get kick-started on your career, actually in an early position or an early faculty scientist. So I think those things excite me, and I'm looking forward to bringing those types of examples to our clinicians.
So it sort of makes me think of these aha moments we have across users that we engage with. So that moment where all of a sudden it clicks, this idea of leveraging data, this idea of generating these insights, sharing that knowledge. Maybe we want to talk about what is that aha moment, what an example of an aha moment that you've seen, maybe even with the nursing staff that you've worked with.
I think probably one of the most powerful nursing generated projects that I've worked on is around wound care, and seeing how wound care is managed in Intermountain Health System. And we have a nurse who's an AVP, and she, takes care of hyperbaric wound, and she is able to look at the landscape of how they care for patients with wounds, how quickly, what types of meds, how soon do they get them into hyperbaric, and can they preserve limbs by understanding this data, learning from it, and reacting more quickly with certain types of interventions. And she's been able to do that, and she's been able to document it with MDClone, see savings, see the quality of care improve. And so that's been super exciting for sure.
You were talking about collaboration as being sort of at the heart of what we're up to. Yeah. And I wonder, what is that going to look like for the University of Chicago in the next few years?
Yeah, I think it's going to evolve over time. In the beginning, the collaboration is really going to be us seeking partners and sort of getting them to this aha moment. And it's needed, right? So I work with with faculty members most of the time, and I can see them glaze over immediately as you start talking about what the data is going to look like, all the process, the steps, what they're going to need. And that's in the old way, in the old system. And they're like, I don't get it, right? And it's just like immediately you've lost them. And so I'm like, okay, they really can't work with this type of data. But this makes sense, right? This is an interface. This is something that they're used to. It looks like a patient record that they can put their hands on in the medical record, and it's now actionable. And so I think our partnership is going to grow. I'm actually thinking about nursing, and like, we really need to go out and talk to the nurses because they don't even necessarily have, their questions aren't even being enabled right now in our first pass at all of this. But partnership is going to come with you and with our faculty, clinicians, staff, as we engage and say, hey, what are you interested in? What's happening at the bedside in your unit that might be actionable here? Wound care, pressure ulcers. These are all things that I get regular requests for on the research or quality side, but that may or may not be prioritized against the, long list of things that we're doing. And so I think it'll evolve. I wish I had a straight answer, but it's going to evolve over time as we get people to that aha moment and they see how relatively easy it is to work within the tool.
I think some of it is empowering nurses too, like helping them understand, yes, you can come to this, you can ask a question. Yeah. I've been working on a project around falls. So falls for me, I'm very passionate about it. Patients should not fall in a hospital. Happens all the time. It's very costly to the hospital, and it's detrimental, of course, to the patient. And just being able to look at falls with MDClone, I was able to say, let's look at every med they got within 18 hours before they fell. Let's look at it between just the 8 hours before they fell. Were we seeing any trend? You start looking, you say, a lot of them had laxatives. Like, people don't study that. They're saying, they're woozy from pain medication or opioids or whatever. And we're like, wow, we're really seeing a trend here where that's the thing, they're getting out of bed and rushing, I mean, and you just don't think about it, but
that's a really interesting aha moment. Yeah.
That's an aha moment. And it was like, wow, that's something that we could handle. You have a nurse aide go in and say, these patients got that. Let's make sure they have an escort to go take care of whatever needs taken care of. So
The bathroom.
So,
Yeah.
These are the things you talk about with nurses, Daniel. We've gotten into some things that maybe not everybody wants to talk about, but that's what.
And no, and they're basic point of care type environmental things. I mean, like
real life.
Yeah, is very much real life and not necessarily the big, money saver research questions or money generator. But in some ways they're money savers because we're not having lawsuits, essentially.
I think you just described this sort of spark curiosity that can come from anywhere inside of a hospital, anywhere inside of a research organization. That spark can come from anywhere, and this entire theme around empowering that to happen way more often than it does in way more corners to people who never had that opportunity before is probably the reasons we're here. And so thanks so much for sharing that. Thanks for sharing those examples. I think they really bring it to life. We're looking forward to many, many more.